Hey guys, so welcome to part 2 of health anxiety. So this is obviously continuing on from part 1. I'll link in the description the video I'm referring to. This will be basically about learning to face your fear of death and overcome health anxiety. So if you remember in the first time we outlined what is health anxiety, what are the symptoms, what is the main preoccupation people are thinking about and worrying about with health anxiety, and basically what that health anxiety monster is telling you to do, and some tips that you can say to respond. So in this session, we're going to learn about ways of getting over health anxiety. Again, so we have Ken Goodman, and he's a licensed clinical social worker, and let's just get right into it. So let's get to the good news. It is possible to overcome this illness anxiety. It's not like, oh, I have it and that's it. There's this woman here, Sally wasn't able to make it. She's another sufferer of illness anxiety who, through the kind of practices that Dr. Ken did, helped her manage her stress levels and her health anxiety a lot better. So how do you get over health anxiety? It's easy. It's simple. I don't want to say it's easy. It's doable. Let's just get right into it. It's possible. That's a good way of looking at it. So first thing you want to do is demand reality. Your doctor went to medical school, so trust your doctor. So if your doctor is saying something, be like, all right, like I don't see any lump there, or I don't see any anomaly anywhere on your skin, then trust that. Okay, right? And also accept that he can't give you a 100% guarantee, because as Ryan knows earlier, our bodies are noisy, and sometimes people get sick. It doesn't mean it's severely ill. And for people that do get severely ill, that happens. You got to understand that that's part of life. That's not gonna go away. That's not gonna. Don't dwell on it though. That's what the main characteristic you want to focus on, because you should just trust the experts, and boom, there you have your answer. Don't diagnose yourself online because you can't. Right. So I hope that's clear. Basically, demand reality. Tell your anxiety monster, okay, well, what's real? What's really real? And that's what's really real. So now we're getting into a question that was asked of the doctor here. Someone asked, basically, so how do I tell the difference between a real illness or health anxiety? Like, how do I know that what I have, for example, a pain in my hand, or a pain in my chest, or a lump in my throat, or a mole that looks unusual, how do I know that that is health anxiety and not real illness? Well, what Dr. Ken says is, sorry, let's move on here. What Dr. Ken says is that what you have is illness anxiety. So focus on that. You may have symptoms of other disorders like cancer, heart attack, etc. But unless those symptoms are diagnosed by a doctor, the mental symptoms, unless those symptoms are diagnosed by a doctor, they are merely symptoms and not conclusive of an illness. So let me repeat that. What you have is illness anxiety, so focus on that. You may have symptoms of other disorders like cancer, heart attack, etc. But unless those symptoms are diagnosed by a doctor, they are merely symptoms and not conclusive of an illness. You don't need to say, "Oh, that's true. That's because I saw it on the internet or whatever. If a test result looks funny, I can conclude that I have that." You can't diagnose yourself online. Also consider when you get anxious, Like when your adrenaline pumps through your heart, you'll experience all sorts of physical symptoms resembling physical illnesses. So you may think when you're really, really anxious that you're getting sick or you're having a heart attack or you're going to faint, when in reality it is just um, anxiety. Hold on a second. Alright, sorry about that. So, the next thing, moving on, I hate technology, is the best thing to do if all these things aren't working is go ahead and get a second opinion, right, and see a different specialist, and leave it at that. Don't go seeing a third opinion, a fourth opinion, and whatnot, because then you're just feeding your health anxiety. Demand reality, reasonable action, reasonable certainty. You can't know everything. So, as you go through life, you have health anxiety. You may have other things in your life, but right now you have health anxiety. So, treat that. So treat for it. Don't say, oh, I have cancer when your doctor has diagnosed you with health anxiety. Or I have a heart attack when your doctor has diagnosed you with health anxiety. Go first with your health anxiety. And to just accept that sometimes if lab values are out of normal range, it's okay. Remember, before our bodies are noisy, and yeah, get medical screenings at regular intervals. So now another question that was posited before we get into this neuroplasticity and everything, another question that was posited and given to the doctor here is, can anxiety cause a tightness in my throat? And he answers, yes, absolutely. So people always talk about muscle tension and like, I feel like tension in my shoulders, but that can happen anywhere. Anywhere from the throat, down into the chest, into the stomach area. Anywhere you can have tightness. Down to your feet, so anxiety can cause a lot of muscle tension anywhere. So sometimes people will feel it in their throat, and they might think, oh, my throat is closing up and I can't breathe, or what if this is throat cancer, or what if I won't be able to swallow? So that's a definite symptom of anxiety, and that obviously comes back to my channel. We're talking about choking phobia and swallowing disorders. That for some people that may have choking phobia, it could be you have illness anxiety and you don't have choking phobia, or you could have both. I mean, I had a tiny bit of illness anxiety, as I said in my first video. You can learn a little more about that with the test results. So, moving on. Another question, because there's one more question before we get into like how do we deal with illness anxiety and the real meat and potatoes of it, is have it here. Let's say, can pain be related to anxiety? That's the question. And he answers it quite succinctly. He says, it can be, so, if it's definitely muscle tension. If it's muscle tension, then yeah, it could definitely be, sorry for the close-up of my face. It could definitely be illness anxiety. So now we get into how do you rewire your brain, because we talked earlier about how the brain has different regions, the prefrontal cortex and the amygdala, and how if we rewire the circuitry of those areas, we can rewire how we perceive illness, fear, and anxiety and distress, and these feelings of death and whatnot. So because of neuroplasticity, you can change the wiring in your brain. It takes practice and hard work. So it's like learning to type. Right, at first it seems really hard, but if you practice like 30 minutes a day, eventually you'll, like magic, you'll figure, oh man, my fingers will just know where to go. It's not magic, it's hard work, okay? So what happens is the neurons in the brains change. And we mentioned this last time about historically we thought that the brain would only change in a negative fashion, like dementia and Alzheimer's. Now we're realizing it can change it into a positive fashion as well. You don't need brain surgery, you don't need like any sort of thing like that. You don't need drugs. What you need is something called exposures. So of course, people who are veterans of my channel know what exposures are and how I talk about them and how I love them and how I always say, hey, let's do another exposure. Exposures are awesome, and I really swear by them for a lot of anxiety things. So let's just do a quick refresher in exposures, because that's basically what he's going to get into next. And he's going to talk about how exposures are how you deal with health anxiety. Not only health anxiety, a lot of anxiety disorders. So there's ways you can do exposures. Obviously, you can do a spontaneous exposure. Like right now, I'm going to do an exposure. Planned exposure for practice. Like say, for instance, I'm going to, later on in the day, write a story about me getting cancer and a heart attack and dying. Or a planned exposure in the context of life. Like, going to the doctor when you have a test, and when you get the results, not getting a second opinion, and just accepting those results and being okay with them. Those are the three main kinds of exposures you can do for health anxiety. Alright? Now, people are wondering, what is an exposure? I'll give you the definition for people who don't know yet. Exposure, simply put, is anything you do where you face a fear. You are exposing yourself to what you are afraid of. That's it. It's anything where you face your fear. You expose yourself to what you're afraid of. And of course, facing your fears will increase your anxiety, so do the exposure step by step. I talked about this, graduated exposure versus flooding. You definitely want to do graduated exposure over flooding, because graduated exposure is better. So, moving on to blood pressure fear exposures, because a lot of people have a fear of going to the doctor and getting their blood pressure taken. That's a little common when people have health anxiety. What you want to do is just do it at home then. Do your blood pressures at home. And if you're too anxious to even take the blood pressure, the first thing you want to do is just start holding the blood pressure cuff thing, just holding the apparatus for 6 minutes a day. Try and do some deep breathing. See where you are at that. And once you're comfortable with that, you'll be able to take your own blood pressure eventually. It's important not to give yourself a time frame. Just say, okay, it's going to happen when it's going to happen, and trust the process. Yeah, okay, so now I'm going to get into, so now he gets into, think of it like you have to invite the anxiety, alright? You have to kind of invite these thoughts that you feel, that I have health anxiety, I am ill, I am gonna have ALS or cancer or heart attack. Just invite it, bring it on, any of those symptoms and those thoughts. And he'll do an exercise later where that's what he'll do. He'll put up words, and he'll invite the people to just kind of be like, bring it on, it's okay. Because they're just words. They're just words, and they're not really real, you know what I mean? Like, these words, murder, or earthquake, or car accident, a fatal car accident, or cancer, or brain tumor. They're just words. ALS. And once you get into kind of being okay with saying these words, do it longer, but probably like juggling. Have like in your hands a juggle, so when you're juggling you can or have a ball in your hand or something, so that you could be saying those words and doing it in a longer period of time by distracting yourself. Another thing you can do is obviously breathe, relaxation exercises. Talked about that earlier. And that's basically what he's talking about, doing these exposures and being okay with the words, being okay with, thoughts that are unsettling, thoughts that you may be like, oh man, I might have it because I'm thinking it. But when in reality, they're just thoughts. They're just a symptom. It's an irrational thought, and it's not true, right? Is there any evidence that these things are happening? Yeah. Really, that's what it's really about. It's about kind of, okay, Well, give it to me. Give it all to me. What? Uh, if this lump in my throat is throat cancer, then okay, give me throat cancer. I'm ready for it. I'm gonna, let's give me the worst symptoms of it, right? And once your heart rate lowers, you'll realize it's not that big of a deal. Yeah, add some amusement. Say these words in like different accents. Like English accents or Italian accents. They're just words. They're not gonna just because you think a word doesn't mean you have that thing. So that's basically it. Increase the duration of the exposures, increase the intensity of the exposures. For more information about exposures, I have plenty of videos on exposures. This is just kind of like a brief summation for health anxiety, how to deal with it, how to do an exposure. Yeah. Look, they're just words. It doesn't mean you're gonna get this. It doesn't mean you're gonna get these things. Couple more questions I'm gonna get into, and then I'll wrap it up here. Question. I have a scheduled routine medical checkup. Going to my medical checkup, can I bring up anxiety? Is it important for me to go anyway? And is that a kind of exposure? So basically, if you feel anxious going to your routine medical checkup because you think the doctor might, you're gonna have something, do you go anyway? Is that an exposure? He says, yeah, that's a definite exposure, and you definitely need to do that. You could build your way up to it, or you could go if you feel like you can just go and go. Because those are what our exposures are. Another question: when I'm reading my social media feed, that often makes me anxious. Does that qualify as an exposure? Like reading different things, or reading different things, or coming into contact with social media posts about cancer, or heart attacks, or strokes, or whatever, ALS, or earthquakes. The answer is kind of like have a proper mindset for doing exposures. Whereas like you got to be like ready to invite it. Bring it on. Bring on all those anxious symptoms and all those thoughts. Like let's say for example, stroke or an earthquake or a car accident. Bring them all on. Okay, I'm having all these things happening right now. Okay, so how should I be feeling? How am I feeling? Okay, I must be feeling this way. And then you'll see it's just thoughts. They're just thoughts. But let's see here. Another question here is, let's say I'm having some I'm having some physical symptoms and I'm not sure, maybe there's something medical, maybe it's my health anxiety. My doctor concludes that it is not a medical condition. Should I rely on my GP to treat my illness anxiety, or should I look for and find a therapist like you that has some background into these kinds of tools that you're introducing? And the doctor answers, well, if you have illness anxiety, you definitely need to, find a professional, psychiatrist is useful to prescribe medicines, as well as a therapist who specializes in treatment of anxiety. They don't all do it well, so you really want to find someone who specializes in it and does CBT, acceptance and commitment therapy, ERP, and usually the people at the ADAA website who are listed there have the expertise. So he's referring to the Anxiety and Depression Association of America. So I'm gonna just wrap it up there. I hope the video was helpful. It's part 2 of health anxiety, and yeah. So hope you guys enjoy. All right, bye guys. Stay with it.